This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm T.G. Lafredo, and this week I'm coming to you from KRMC Speech and Hearing Specialists. My guest is Dr. Akila James. She's a doctor of audiology here. Dr. James, welcome.
Thank you. Thank you for having me.
Thank you for having me. We are in your office. I'm excited to be here, and this is the first I've gotten to meet you, but you're not brand new here. You've been here for a little bit.
Yeah, I've been here for a little bit over a year, maybe a year and a half, I think.
Yeah. I try to catch, but so you came on sort of during the pandemic still, right?
Yeah, around. So I started in July 2021.
Okay.
So towards like middle of pandemic, I would say, not exactly the starting, yeah.
Okay. Yeah, I don't know when it officially ended, but it seems like we're moving on, which is a good thing.
Good thing, yes, it is a good thing.
I love audiology, it's so fascinating. To me, I'm an audio geek, and I love sounds, and I would rather, for example, we were talking a little bit about sports. Generally, I would rather listen to sports than watch them. So I love the ear. It's fascinating, and I try to steal this information. I come with my own questions. I hope that listeners enjoy, but I have questions. So
sounds good. I'll try to answer them as best as I can.
So usually when we first talk with a provider, I like to kind of get a little, do a little getting to know you, if that's okay with you.
Yeah.
Where are you from, may I ask?
Yeah, so I grew up in Phoenix, Arizona. That's where I did most of my schooling. Yeah. And then I went to ASU for both my undergrad studies as well as my doctorate studies as well. So I've been in Arizona for quite a long period of time.
Yeah.
Yes.
And why audiology? How did you choose that for your path in life?
Oh, that's an interesting question. But after high school, I kind of wanted to see what I wanted to do. For sure, I want to be in healthcare field. But I just didn't know what other areas are out there other than maybe nursing and doctoring and all that stuff. Yeah. So I kind of had a talk with my family physician about it, and she introduced me to speech pathology. And I thought it was very interesting because that is not something that's spoken about quite a lot. It is a small field, as well as audiology is also a small field. And then went over to ASU and I saw they had a degree and I took the degree, and that's actually my first time into that audiology area too.
Yeah.
But I've personally found it very fascinating too, because sound is it's around us, it's kind of our window kind of thing, but no one really talks about when it breaks down, what can we do kind of thing. Yeah. Even within my family, I had a lot of older people, and it was something like, oh, you have hearing loss, something part of the aging. It was never taken care of. It was seen as something that you kind of have to live with kind of deal. So for me, that was where my fascination or interest in it started. Yeah. And then I guess I'm here now. So
audiology is interesting, right? Because in addition to being, well, as I understand, in addition to a lot of the physical and mechanical stuff having to do with the ear and the inner ear, there's also a lot of neuroscience that goes into it.
Yeah, so at the end of the day, we're here with our brain. So even if all the mechanical part of the ears is good, if your brain is not working well, then of course that can also impede your hearing as well. So yeah, it's a combination of mechanical and neurological, like you said. It's a very, very interesting field. There's a lot of research being done on it currently, so we can even understand it more as well.
Okay, very cool. Okay, so I'm dying to ask you about some of that stuff. Let's come back to it. Let's finish up some of our kind of getting to know you.
Yeah.
So what brought you to Kingman? You said that you've been in Arizona for most of your life. So.
Yeah, so I studied basically in Arizona, so most of my family and friends are here. Yeah. But I did go up to California for my externship, which was kind of nice. But I always knew I wanted to come back to AZ. That's just where my family is, and I just feel like home here. So when I was applying, I was just looking for different jobs around here. And then I just thought KRMC offered a more variety of things I can do. It's just not focused on just hearing. There's also a balance portion of it that I was also very much interested in, because it is also a sub-area of audiology as well. So it just gave me a good variety of things, and that way I can see different patients with different problems and I can help them appropriately. So that gave me that nice variety that I was looking for.
Becoming an audiologist is a lengthy tract, right? I mean, you have a doctorate in audiology. It is, so how many years of school would that be?
So it's a total of 8 years.
Yeah.
There's 4-year undergrad, which I did mine in speech and hearing science, and then there's the 4-year doctoral degree. Of the 4 years, 3 years is just studies and classes and a little bit clinic here and there. Yeah. And the 4th year is when we go up to your externship and you really get hands-on kind of experience working with different patients and different settings and stuff, so you know what you're doing as well.
Yeah, so in the externship, you're working in a clinical setting like this?
Yeah, that's right. correct.
under supervision of somebody with.
That's correct. So I work with another audiologist or under her. I did my externship in California at an ENT setting, and that's just because I really like the medical side of audiology as well. It was very cool. We got to see a lot of very rare diseases and disorders and stuff, and how to manage those as well. So it was really nice working with the doctors because they were ENTs, so we kind of see what they do for their patient, because at the end of the day, both of us are working together.
Sure.
So I really, really enjoyed that placement. So, but you can do your externship at any placement you choose to. I just chose an ENT clinic.
You said you saw some of the uncommon. Did you see synesthesia?
I didn't see synesthesia a lot, but we were right next to the beach. So we got a lot of people that swim in cold waters.
Okay.
So what happens is if you do that a lot, our body or our ear is trying to keep itself warm. So it grows out these bones in your inner ear.
Really?
It's very interesting. You don't get to see quite a lot in Arizona, but around the
right.
California area, you see quite a lot. So when you look into the ear, you see these bony protrusions that kind of
Really?
grows around
And
your...
it's kind of like a defense mechanism.
It is a defense mechanism, but as you can imagine, if there's too many bones, it just blocks the sound to that ear.
Wow.
So a surgery is required to kind of like remove.
Really? Now, would this would be for an avid surfer or?
Avid surfer, we also have swimmers, deep dive swimmers, anything with cold water is there.
And they find more and more that their hearing is kind of getting away from them, and they get it checked. Or I guess maybe they're aware
Yeah,
of
so
that.
they started noticing maybe you have ear infections or like you're not hearing as well, and then they come to check an ENT. He looks into it, he sees bones, and sometimes if it's a little bones, it's fine. If it's not blocking the sound, it's okay. But if it's so it's with a lot of overgrowth there, then we kind of have to take that.
Yeah.
But that's probably like a mechanical damage to the ear kind of thing. So once that bones are kind of removed or taken down, then you should be able to hear fine. But
It's very interesting.
very interesting,
Talk about rare, yeah. You probably don't see a lot of that in Arizona.
Not here yet.
Well, we talked about some of the rare things, but let's talk about some of the common things. Tell me a little bit about a day, if there is an average day here in the clinic. What does an audiologist do all day?
So for me, it's a combination of different appointments. Most of it's, of course, comprehensive evaluation. That's usually like the first step. We kind of want to see, do you have a hearing loss? Where is it coming from? What can we do for it? So that will be a majority of my appointments. Of course, we do dispense hearing aids and other hearing assistive technology as well. But those are kind of like the second part. The main thing is your hearing and your ear health. That's what we try to focus on here. Because if those are not well taken care of, then the rest of the requirements of the recommendation doesn't make sense. And then we also work with hearing aids, and of course making sure they're programmed. If you do have hearing aids, that they're programmed for you, verified for you, making sure they're working well. We also do VNG, or which is the balance portion of the testing as well for patients that are referred here. For those, it's usually people that experience balance problems. We want to figure out if that is coming from some sort of abnormality or damage to your inner ears, and that's why that test is done. And we also see kids from different ages, so different kinds of tests and instruments are used for getting results from a kid. Because as you can imagine, not everyone wants to, all kids is cooperative in testing. So we just want to make sure we use different tools we have to get as much result as we can.
Sure, right. Sometimes if a kid is having trouble in school, it may be as simple as like he can't hear very well or her eyesight isn't that great.
Yeah,
right?
Absolutely.
And teachers might be thinking, if they're not attuned to that, they might be thinking, well, we've got a discipline problem. No, we're not really getting through. Right? That's
right. I actually had a patient very recently, and the mother was complaining, I feel like she's not hearing me, like she's not paying attention to me. And we did the testing, and she actually ended up having a loss. And she felt like she felt bad as a mother. Yeah. She felt like she was a bad mother.
And she should have felt bad.
Right. But I mean, thankfully she was here, and we were able to take care of it.
Which is what a good mom does.
Right. Yeah. And so we were able to find it in the early stages, it was just an ear infection that can be taken care of by antibiotics, or if it's like tubes in your ear, if it's for fluid, and then she should have a hearing within the normal range, I should say. But yeah, so we do see things like that. It's anything, if you start feeling like, something's not, it doesn't seem right, or it doesn't seem like how it was before, then it's always a good time to just come in and get a check. Yeah. That's what I would say, yeah.
When we think about hearing loss, I mean, typically for me, I think about older folks, but are younger people a significant portion of your practice, or is it mostly older folks?
It's mostly older, but we do get about, I would say, 15 to 20% kids that have hearing loss. And I mean, there's a variety of reasons. Some people are premature, or they may have some other disorders that also causes them to have hearing. There's genetic factors is a big thing as well. If you take some sort of antibiotics, let's say you had some sort of complications during pregnancy and the child was born and they had really severe pneumonia or something, or jaundice, and they need to get blood transfusion and stuff, then there is more chance you get a hearing loss or you have a hearing loss. But usually we want to be really careful with NICU babies because they are most likely to have hearing loss compared to the other ones. But
That's interesting.
Usually every hospital checks for hearing. It's a newborn hearing screening, and if they pass it, that's great. If they don't pass it, we do have what we call ABR, auditory brainstem response testing, which we do in the clinic, and that's for kids with a more comprehensive test to make sure all parts of the ears are working and well. And then Dr. Ben actually does that here. So we do get our fair share of newborn hearing screenings or tests as well.
That is interesting. And with the newborn, how do you test the newborn's hearing?
Yeah, so as you can imagine, they can't give any results to us. So what we use is electrodes. We put electrodes on different parts of the ears and the brain. What we're doing is we're playing different frequency tones and seeing what is the softest sound that the brain is getting activated to, or the brainstem, the auditory nerve is getting activated by. And so we do have what we call a table that shows if the child is this years old or this condition, this is where that response should be. Okay. So if you're not getting response there, or we need to be the response has to be at an elevated level, then we know something's going on, kind of thing.
When we talk about young people who have hearing loss, is there hope for them to recover? Are there procedures? Are there things that they can do, or are they kind of stuck with that?
It kind of depends where the hearing loss is coming from. So we talked about the mechanical side of the ear too. So for a lot of younger kids, it's just fluid in the ear, or they have an infection or something like that. And if that's the case, if the infection is gone, and that usually take antibiotics like that, then they should be able to hear, or their hearing should be back to the normal sensitive range. If they have fluid in the ear, sometimes the fluid doesn't drain by itself. It's a very common thing for kids under the age of 7 to have fluid in their ear, and that's just because anatomically that eustachian tube, which is responsible for draining the fluid, is not exactly the same as an adult. It's kind of like straight or horizontal compared to the adult's eustachian tube, which is kind of slanted down. So the fluid is able to drain much easier.
It actually has to do with gravity.
It's how the structures are formed. It's just the facial nerves and stuff. As kids get older, their facial muscles and stuff kind of form, and their bone structure also changes.
Sure.
So your eustachian tube becomes more of a slanted kind of way, and that makes it easier. But for kids, if you have fluid, it's fairly an easy procedure. They put tubes in the ear to drain out the fluid, and then that should also get, for most cases, that should also get their ears back to the normal hearing sensitivity. So it kind of depends on where the hearing loss is coming from. Yeah.
If you're just joining us, this is Focus on Your Health. I'm T.G. Lafredo, and this week I'm speaking with Dr. Akila James. She is a doctor of audiology at KRMC Speech and Hearing Specialists. Dr. James, when we talk about older folks, we often just assume, I think, that hearing loss is a part of getting older.
Yeah.
Just as, kind of diminished eyesight, I say, because I'm sitting here wearing my glasses. Is that right? Do we need to expect certain hearing loss as we get older, or is there something we can do about that?
No, it's not like aging causes hearing loss. That's never the case. It kind of depends on your history too. If you are someone who's been around a lot more noise than your average person, then that's possible that your ears have got more damage from loud noises. In terms of, are you able to expect, there's also a genetic factor to hearing loss as well. So if your family members have hearing loss, then you're more likely to have a hearing loss as well. So it's not just because you're going old, you're going to get a hearing loss. That's not the case. It kind of depends on a lot of other factors too. But there are things you can do when you are younger, if you are around loud noises, like using good hearing protection. That is going to help you in the long run, because you are blocking that loud sounds from entering into your inner ear and causing damage to the structures there. Because like I said, remember, those structures at this point in time, if they're damaged, they're damaged. There's nothing you can do to reverse them. Yeah. So it's important to use good hearing protection if you are around loud noises. And some people are not really sure what loud noises is. Anything could be loud noises. Like our blender in our home is a really loud sound. Or if you use grass cutters or blow like dust and other stuff out. All those machines are very loud, and you use hearing protection. If you're one of the people who are around music quite a lot, then hearing protection is a good thing. Yeah. And many patients who've been around a lot of noise and they never wore hearing protection, and you can, when you talk to them and when you do the test, you can see that they kind of have that classic kind of hearing loss there too. So yeah, anything you can do when you're younger. I know when we are younger, we kind of feel invincible, like nothing's going to affect us, but it's going to catch up to you as you get older and older. Especially now with kids, a lot of them have headphones and they're listening to music really loud and all that stuff. So it is possible as the years pass by, we're probably going to get these patients that are younger and younger rather than just 60s or 70s.
For
because
sure.
the world is getting more noisier. It's not going to get quieter.
It's not my imagination, is
Yeah,
it?
no.
No. For you, good hearing protection, what constitutes that? We're talking, so then we should also say like people who are operating loud vehicles or people who are using firearms, right?
Yeah.
And they should have the shooter's muffs or the foam plugs or something like that.
Yeah, so if you're going on shooting, like target shooting or something on a regular basis, then we usually do 2 different types of protection. You need to do the inserts as well as the muffs because gunshots are really loud sounds. So we want to attenuate it as much as you can. The other thing I usually tell people, if you are a musician, you work with music a lot, then it might be worth spending the money to get custom-made earplugs for you because it is protecting your ears. It's just dampening the sound without changing the frequency or the sound quality of music. So that would be something worth the investment for. If you're just going on a concerts and stuff, some concerts can be really loud. You can get the little insert headphones or earplugs from like Walmart or some other store. The main thing is that you put it in really good because if you don't put it in right, then it's not working for you either. Yeah.
I would like to put forth my unpaid testimonial about. I'm a musician. I've been hitting things with sticks for 32 years, and that's a whole lot of cymbal noise and loud guitars and all of that stuff. And I have custom fit earplugs, and they are awesome. They are critically important. I wouldn't go to a rehearsal or a concert or a performance without them. I wouldn't go. If I got to the door and found that I didn't have them, well, fortunately I have some emergency foam plugs in my truck, but always, like if I'm leaving, I've got my keys, my wallet, and my earplugs.
Good.
It's true. I know it sounds geeky, right? But I'm super vigilant about it.
Oh, no, that's great. I wish more people were like you, but that's awesome. That's awesome.
For quite a while, I've taken care of them, but I have some tinnitus or tinnitus. How do we pronounce it?
Tinnitus or tinnitus. It's kind of like tomato. You can say either way.
Well, I have tomatoes in my ears. Can we talk a little bit about that?
Yeah, sure.
So what is it? Can you define it for us?
So tinnitus, it's basically what we say is when you have some sort of damage to the ear, tinnitus is usually the first sign that there's some damage done to the ear. Now, there could be a lot of other causes for tinnitus too, but generally the first sign that you have a damage to the ears is a tinnitus. What happens is when you have normal hearing, no damage to the ears, our brain and nerves are used to getting that full spectrum of sound up to the brain. So when you have a little bit of damage or a little bit of hearing loss, some of the nerves that used to get stimulation before does not get that anymore. So they try to make up for the sound it's missing, which is what you're hearing as the high-pitched ringing kind of thing. So usually we get a lot of patients here saying they have tinnitus and we test their hearing and they have a little bit of hearing loss in the higher frequency. So in terms of that's what basically it is. Again, that is also thinking about research, an area that they're doing a lot of research on because they're still trying to figure out where exactly is it caused by so we can actually find treatments to do that. But it's still pretty much out there for people to research on. In terms of any medication and stuff, like I said, if it is based on some other medical conditions, then there may be medication to help that. For a lot of people, it's just their hearing loss that is causing that tinnitus. And so we kind of have to see what kind of treatments are out there, maybe like sound therapy, or for some people, if their hearing loss is bad enough, maybe a hearing aid, or for some people, it's just having some sort of background music so that your brain is not just focused on that. Because a lot of people with tinnitus will tell you when it's a really, really quiet environment is where you hear it more louder. And that's just because there's even less stimulus going up your brain. So the brain has nothing to focus on other than that ringing kind of thing.
Yeah, and if you're listening and you're wondering what tinnitus sounds like, here it is. Oh, no, wait, you can't hear that? That's just in my head?
Oh, okay.
Oh, so you didn't hear that. Okay. I have a friend who says that his is a very low-pitched rumble. Mine is it's higher up there.
Yeah, some people say it sounds like crickets to them, so it comes in different sounds.
In the range of maybe 6K or something like that.
It depends on where your hearing loss is too,
Yeah. Well, and my tests, by the way, are really good. My hearing is good, but
Yeah.
I'm hearing through that lens. You know what I'm saying? If
Yep,
I'm
no,
mixing
no.
my metaphors a little bit. But
Yeah, so usually when we do testing for like a comprehensive audio evaluation, we're testing between 250 to 8,000 hertz because that's where most of the speech sounds lie in
Right.
English in most languages.
So there are a variety of things that you do here in the clinic, but the reality is a fair amount of your practice does deal with hearing aids, right?
Yes.
Can we talk a little bit about what a hearing aid assessment would look like for a patient?
Yeah, so not everyone can benefit from a hearing aid too. So like I said, the very first step is a comprehensive evaluation test. And what we're trying to do there is to see, okay, do you have a hearing loss? Where is it coming from? What degree is it? Is it something a hearing aid can help? If you only have problem in the very, very high frequency, then maybe you're not there yet. And we also do speech tests to see how well do you hear in an average conversation level? How well do you hear when we turn up the volume? So all of those kind of helps us make our recommendations for you. In terms of hearing aids, we do use real ear, which is what we use to verify the hearing aids, and that's the only way for me or anyone to figure out what exactly the hearing aid is doing in your ear. So everything is verified for you. We also do follow-up appointments and any other things or anything you need for hearing aids. We also do that, yeah. But I think a lot of the people think hearing aids are the only thing for hearing loss, and that's not the case. There's also other like accessories, what we call hearing device or hearing accessories that help you. If you have patients that just have problems with TV, maybe the hearing aid is not what you need. You need something else. If you just have tinnitus and that's just it, maybe sound therapy or something else would be the best option for you. So for me, it's very important that I get a good idea of your overall ear health and problems before I make recommendations for hearing aids. But absolutely, if hearing aids is something that's going to help you, then we'll make that recommendation and we can see what we can do for you for sure.
What point, so like if I have somebody in my family, right, who's got some hearing loss, and I see, okay, conversation's a little harder, or the radio or television is up pretty loud, that kind of thing. Mm-hmm. At what point for you is it like some of it we live with and some of it like, hey, really, it's time to go see the audiologist? What do you think the metric is for that?
Oh, I'm glad you mentioned your family member kind of situation. So most patients we see here, their main complaint is, oh, my wife is complaining that I don't hear her.
Yeah.
Or my wife is saying that the TV is too loud.
Yeah. Don't hear her is different from don't listen to her, right?
Yeah,
those are two different things.
There may be a little bit something else there if you've been married for a long period of time. But no, so hearing loss is unfortunately one of those things. It's usually people that are around you that notices it first before you do yourself. And that's because if you have a hearing loss, you're missing sounds, you don't know what you're missing if you don't know what you're missing kind of deal. So usually like just pay attention to the everyday activities. Are you asking people to repeat things more often? The TV is actually a great example. It's one of the main complaints we see. They always talk about, I can hear them, but I can't quite understand what they're saying. That's something I hear a lot about. And then if you're asking people to repeat quite a lot, if you are having to look at their face. Interestingly enough, during COVID, we had a lot of people come in, they said they suddenly feel like they have a hearing loss. It was not that they had a hearing loss just then. It's because when you didn't have a mask, you were able to get by reading lips.
Yeah.
So suddenly when instead of people wearing masks, they don't have that visual cue anymore to the brain. That's when you started noticing, okay, I may have been relying on your lips a little more.
Isn't that interesting?
It's very interesting, yeah. So that was one of the common things I saw during COVID. But yeah, generally, even if you don't have a hearing loss, our brain is a top-down kind of process. It takes into input what you hear, but also put it together with what you see, how your lips move, and they put those information together for you to hear better.
Social context as
Social
well,
context,
right? All those
absolutely.
cues.
Yeah, sometimes you miss one or two words here, but if you know what they're talking about, your brain is pretty good at putting that in.
Yeah, body language and all of that, right?
Right.
It's so interesting how that all comes together.
Yeah. Again, our brain is amazing, but it's trying to help us.
True.
But yeah, when you have a hearing loss, then you are going to focus a lot more on that visual cue compared to, because there's not auditory cues, it's not that good anymore. So that's something we saw quite a lot at as well. So if you started noticing little changes like having the volume up on TV a little bit, maybe asking people to repeat more, or you have to look at people's face more, stuff like that, then it's a good time to come and get a check and get a baseline of where things are.
If people do need to come in for a check, is that, can they call and make an appointment, or is that by referral? How does that work?
So for most insurance, they require you need a referral from your primary care or doctor for us to see it. The best thing would be to call your insurance and see how they work, because most insurance does require, and Medicare patients also require a referral.
That is Dr. Akila James. She is a doctor of audiology at KRMC Speech and Hearing Specialists, and you can reach her office at 928-681-8717. That's 681-8717. Dr. James, thanks again for your time today.
Thank you so much for having me.
And that is the program. Let's focus on your health. I'm TG Lafredo. Thank you so much for listening. We'll catch you next time.